Very quickly, some questions I wanted to ask you, just very general questions, some 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 thoughts about it. So I've seen also some of your cases. Of course, I've studied with you at different points. Share some thoughts about tissue salts because I know that nowadays you use it a lot, and it would be very interesting for our participants to also know that along with so many approaches that you kind of use, you spoke a lot about anti-miasmatic, pathological remedies, and constitutional. I also know that you use a lot of tissue salts along with it. It would be very nice for our participants to know how you use it in that direction.
I don't use tissue salts in all my patients, but many times what happens, you are given a constitutional dose like calcarea carb 1 m, and some acute problem comes up. Okay, and you do not want to use your constitutional remedy because your generals are better, mentals are better, and they get some cold with yellow discharge, rattling cough. Kali self takes care of that. It
Mm.
helps tide over the acute remedy. Let me tell you something. Now, this is from Burnett, okay, the real master of such cases. Burnett writes, you give constitutional remedy, you will be able to treat the mind and general symptoms, but you will not remove the tendency for diseases. You give pathology specific remedies, you will reverse pathology, but you will not remove the tendency for that disease. You give nosodes as anti-miasmatics, and you will remove the pathology as well as the tendency. What it means, that constitutional remedy, pathology specific remedy, these are only helping us helping us to tide over the exacerbation of the complaints which has come up. But for a complete cure, you are going to need anti-miasmatic remedies. But constitutionals, anti-miasmatics, we do not repeat very frequently. We give when really required. So in between, when some acute comes up, you handle it with biochemical remedies. So patient gets better, sticks to you, and doesn't go for
Mhm.
allopathic medicine. And there's one more thing I want to say. There are a lot of misconceptions about these biochemical remedies also. No, some masters have. I have got a very nice book called Dr. Mitra's Biochemic Tissue Salts Repertory. People feel anemia, they give ferrum phos because iron, hemoglobin. But what is written in the book, your RBCs and all blood cells are created in the bone marrow. So you need calcarea phos and natrum mur in biochemic for that, and not ferrum phos. You got it? So I use all these biochemics. Gout. Gout will need natrum phos. Uric acid problems, natrum phos. Any acidity problem, natrum phos 6x.
There is a very nice book for the participants they should know, and I will of course take a session on tissue salts. There's a book by David Card where he has worked on physical traits and just looking at physical symptoms like yellowish acne and things like that, and remedies like natrum sulf and natrum phos, and it's a brilliant book. Something similar to what Dr. Borkar is also talking about. So yes.
Tide over the acute conditions, to tide over the acute crisis which comes up, which doesn't need repetition of the constitutional remedy. And that gives very good results. This is what I want to say.
Brilliant, brilliant. And the other thing which is very fascinating because some of our participants may be also listening for the first time. I know that you have studied extensively on miasms, especially in the last few years. And I have seen you with different concepts, right, from pathological factor to the recent ideas. It would be interesting for our participants to know a little bit about miasmatic traits. The 3 4 important miasm that you spoke about, the Sora, the Hahnemannian miasm. What are the traits that you look at for each miasm? Just a little glimpse of it. Of course, we have many books on it, but it would be very nice, the important glimpse. Dr. Vijayakar has spoken a lot about certain traits. There are Allen has written certain important hints, and Banerjee has also written something very beautifully. It would be very nice to know from you.
I'm going to say is from Chronic Diseases by Hahnemann and medicines written by J.H. Allen. So Hahnemann wrote most of the diseases, everything is Sora, but 7/8 of diseases are Sora, and 1/8 is psychosis and syphilis. And he has given in chronic diseases all symptoms of Sora. He says Sora causes tumors, destruction of bones, cancers, everything is psora. And then psychosis, he says, is condylomata warts, which are cauliflower-like growths, and valvular heart disease. That's all. And then Allen, in his book Chronic Miasms, writes a lot more about psychosis. He says that now psora is blended with psychosis. Everything that we say is psora plus psychosis. And there he writes arthritis, any inflammation of any internal organs, pharyngitis, sinusitis, gastritis, appendicitis, all itis is psychosis miasm.
Basically, catarrhal pathologies are typical psychotic in the ground, isn't it?
And he says if this is suppressed, then you go into secondary psychosis, much serious internal psychosis, which is diabetes and Bright's disease, kidney diseases, cancers, and lupus, more serious diseases. This all starts if the first manifestations of psychosis, like if warts are removed, if inflammations are suppressed, then this comes up. So today what we see is people have all the miasms combined, but yet there is one miasm which will be prominent. And in majority of the
Miasm, something that you see at the upper layer, yeah?
cancer miasm may be prominent, strong family history of cancer. Strong family history of tuberculosis, tubercular will be prominent. So every miasm has some characteristics which will tell you, like tribal desire to, it is tubercular miasm. If glands, bones, mucous membrane, and eyes are involved, syphilis miasm. Just from the sphere of action, the miasm. Eyes,
Yes.
glands, mucous membranes. Night aggravation.
So there is a very nice book. I am sure you know about it by Phyllis Spite. She has written a very nice tabular form of miasm. It's a very small booklet, very similar to what you're saying. It's written in there. You obviously know about this book.
Talking is entirely from Hahnemann and Allen. Okay.
Yeah.
I use this in practice. In Hahnemann has written how pimples of syphilis, eruptions of syphilis miasm look. Bluish red base.
Mm.
If that is how it looks, bluish red base, then it is just
Mm.
acne. You can say whether it is psora, syphilis, or psychosis prominent. This is given by Allen's miasms. I would recommend must read the Chronic Miasms by Allen and make your own notes. It is a wealth of knowledge there. So what
And just for our participants, sir has already taken a couple of sessions about this in our earlier courses. If they wish to join one of our earlier courses, we have very interesting talks by him about specifically about it. We are talking about a year, couple of years back, sir has taken. And sir, also what is interesting, along with miasm, along with these things, you are then also talking about a little different concept of organo-specific remedies or pathological remedies. And I know that you have extensively worked on it as well. And what is your idea about pathological remedies or organo-specific remedy? Because sometimes what happens is our participants, and I know even myself in the beginning, we are very mesmerized with the idea of this pathology, this remedy, and little later we do realize that there is this peculiarity even in the pathological remedy. For example, in a case of solid ego, you want to see the pain around the kidney region along with proteinuria. If it's a stellarea media, you want a shifting rheumatism better by open air. If it's a stillinga, you need a night pains along with the bone pathology. So it would be very interesting for our participants to know how you understand it, maybe with some of your experience.
thing is, you have a constitutional state which usually takes care of is present in all your problems for a certain period of time. And that may lead, because of some stress and strain, it may lead to a gross structural pathology. Once the pathology develops, the pathology itself produces its own symptoms. This is a different state. But the patient's individuality is stamped on that pathology. These are Boger's words, okay? So there is some peculiarity there. 4 people coming with the same pathology will have different peculiarities. Based on that, you select your pathology specific remedy. Like for renal pain, somebody gets from me senecio, somebody gets senega, somebody gets solidago, somebody gets chimaphila, for somebody I get eupatorium purpureum.
Mercurium.
finger remedies. And I have like a list of maybe 30 remedies like this I use for uremia. But Cupramars has its own flavor.
With convulsions, with brain-related symptoms, with the kidney-related pathology, Cupramars, yeah.
So it's uremia only, but every remedy has a different peculiarity. So look at the pathology and see what is the peculiarity. That will give you a pathology-specific remedy which is required if you want to reverse advanced pathology.